ki khubor ka Batisi TV lawan ra shapi da ka Orange Nissan Loom so pho near Fire Brigade Shillong
Rangkat lang bat kari India barok away ka Jylla Meghalaya lengba ka office trekam jong ka Meghalaya AIDS Control Society State Blood Transfusion Council harengkat ka jinge tre lang bat barok ki jaka kan show Snam lani ki blood bank ki badan hapok ka Jylla haga shitari ku benai risau arajar arpoi kala Rakhe ya ka Sngi Snam lani ka blood donation day kum shibenta ban pentip syaki pait ba baga jing ngob ha yala ka Snam kan Ïada ya ke Mynsiem Briew ki badon kam ya ke Ïada bakerki hagi kep badon kam haga jing Rakhe ke balalong hadon Bosco Youth Center lai mukra lai shimenta langru dau principal secretary ke tenat ke koi kakia ke sarkar Jylla upi Sampath Kumar ubalalong kumu kongsan bad ubadairu haga jokopor u president jong Meghalaya AIDS Control Society ka Dr. Mrs. C. Butna, kabadai ka Member Secretary Jong State Blood Transfusion Council, Shillong, ka Dr. Mrs. R. Momin, kabadai ka State Coordination Officer Jong State Blood Cell, ka National Health Mission, u Dr. M. Mauri, kabadai State Tuberculosis Officer ka Sarkar Jylla, ka Dr. Mrs. R. Ale, kabadai ka Project Director Jong Meghalaya AIDS Control Society, bat kiway. Hagani ka Sngi lapun ko buramru ya ki kunhon Snam bat ya ki Briew shimet ki ba judan menta haka ba Snam nakapor sakapor.
The state has brought this positive healthcare model where we are going to focus on preventive along with curative and also enabling. So preventive, curative and enabling. These are the three dimensions through which we are going to work, and we are working actually. And this is giving some good results also. The way actually this is one of the examples that what we have actually celebrated today, how actually we are trying to improve the blood transfusion services, because one of the reasons why the blood transfusion is required is that because when I'll give an example, out of the pregnant women what we have in Meghalaya, as per the NFHS data, 53% are anemic. What does it mean? Pregnant woman, anemic is not, basically, then if they are severe anemic, you require blood transfusion services. You require, and if there is a retained placenta during the delivery, if there is a postpartum hemorrhage where, so in such cases, you definitely require, blood transfusion. So this is where, we require a lot of awareness about it, that, how actually we can prevent that, before coming to that stage. Can we prevent the anemia? Can we reduce the anemia before actually, they come for the delivery? So these are the things that we have been working now, like putting a lot of focus on that preventive aspects. At the same time, when there is a need, we should be able to have the services. So that's another very important thing. And I'm sure, with this kind of an efforts, with all our collective efforts, with both the government and the missionary hospitals and the private hospitals and and the entire civil society organizations that are working for the promoting this voluntary blood donation, I think we should be able to meet that challenge, and we should be able to provide the better services to the people. So with this, I would like to again congratulate the team that is working for organizing this one. It's very, I really wanted to place an appreciation for the Meghalaya AIDS Control Society for entire team coming together and basically giving a song, presenting a song that is inspiring everybody.
Thanks. And may we have Mr. Mark Woodbury, please. Next, I'd like to call on Alex winners. Alex, tell him Mr. Peter. So I might add, he's also a staff of the licensed blood center during the period from September 2020 to September 2021. And last, next 54 units of blood during that period. Collected 90 units.
Neighbors, and last but not the least, Jylla Civil Hospital.